You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauryn Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life. You owe yourself the love that you so freely give to other people. Unknown. So how's it going, Travis? What's up?
not a lot, because we did this yesterday too. But I took Duke on Julia and I took Duke on a 4-mile hike today.
Nice.
Up the mountain, and it was gorgeous. And he rolled in and ate a bunch of poop.
Living up to his name of Dookie.
Dookie Doo.
Dookie Doo.
What's going on in your world?
Well, like you said, not a whole lot since yesterday. We basically had the same day as you did. We just spent a lot of time outside with Keely, enjoying the weather, taking lots of walks, rolling around in lots of grass. The dog did, not us.
Either way, sounds great.
Yeah, it was a nice day, and now we're here. And I thought today we could talk about airplanes.
Airplanes? What?
Okay, not exactly airplanes. You know how when you go on an airplane, the flight attendant will always say something like, before you put your oxygen mask on your child, you have to put your own oxygen mask on first, right?
Yeah.
Why do they say that? Isn't taking care of other people supposed to be a good thing? Aren't we supposed to care for other people? Right? But what if we do that to the detriment of our own health? Is it selfish to care for ourselves first? Is self-care selfish?
Well, I think being selfish would mean there's a desire to take from others, and often to their detriment. Self-care is more about replenishing your resources without depleting someone else's, to restore your own energy and promote healthy physical and emotional well-being, which will allow you to take care of others better. The analogy that you're making is basically, if you don't put your own oxygen on first, you might pass out struggling to get the mask on your frantic child, and then you both end up dying.
Right. So it's better to take care of yourself first so that you could hopefully help somebody else. It's really, you have to be selfish to be selfless.
Yeah.
But this makes a whole lot of sense, right? Especially, for everybody. You have to pour into your own cup before you pour into other people's cups. That makes sense for everybody. But I think it's especially prominent in healthcare professionals, right? Because we see that's one of the highest risk groups for burnout is healthcare professionals, given the amount of emotional strain and stressful work environment of providing care to sick or dying patients. So I know there's a lot of research about burnout, but is there anything that shows that we can prevent burnout?
Yes. So there's several studies, and they're studying this a lot right now because it's not becoming more of a problem, I don't think. It's always been a problem. Mm-hmm. It's just people actually care about it now, which is good. So there's a systematic review that basically says there's strong evidence for the use of mindfulness practice to reduce job burnout among healthcare professionals and also teachers.
Oh, that's really cool. Nice. Yeah, they have a pretty stressful job too.
I guess. They get off 3 months a year though.
That's true, but man, I don't know that I'd want to be a teacher. I work in a school district. Yeah, they have it tough. We also found a literature review that looked at self-care in mental health practitioners. And this literature review saw that a lack of self-care is related to higher levels of burnout and secondary traumatic stress symptoms, a greater risk of health status decline, and the experience of stress. They also found that engagement in self-care on the opposite end is associated with greater well-being, lower levels of stress and negative affect, higher higher levels of positive affect, flourishing self-rated academic and clinical performance, compassion satisfaction, and better quality of life, which is a lot of things. It's not as high of a level of evidence as maybe a systematic review, but I still thought it was a nice little summary of like both ends of either you have self-care or you don't, and how that affects your performance and level of burnout.
Yeah, good one to bring up. They looked at a lot of different things.
Mm-hmm.
So it seems like there's good evidence that self-compassion techniques decrease burnout. How else can people who are maybe not in the healthcare field benefit from self-compassion?
Yeah, I feel like everybody can benefit from self-compassion, but there are research articles to back that up as well. One of the ones that we found was looking at self-compassion versus self-criticism in female athletes. So it looked at 82 women athletes from a variety of sports and competition levels who completed measures of perceived sports performance, self-compassion, and self-criticism in sport around a scheduled competition. And the study found that those who reported higher self-compassion, they saw themselves as performing better in their sport compared to those who had higher self-criticism. So those who were looking at themselves with higher compassion and kind of taking that time to do that extra level of self-care actually saw their own performance as better than somebody who had more self-criticism. That kind of goes back to our like negative versus positive self-talk.
Yeah, similar. Well, that's cool. So another one looked at 37 mental health professionals that each completed a program that consisted of 6 2-hour sessions offered once a week over 6 weeks and used a range of mindfulness techniques. The results suggested that mindfulness training was effective in reducing stress and improving mindfulness and compassion. So it reduces your stress and makes you more compassionate to others. Again, saying that you can take care of others better because you're taking care of yourself.
Right. Yeah. Which is, again, getting back to that basic question at the beginning, is it selfish to do self-care? And I think after this, I would argue absolutely not, because if you pour into yourself and take care of yourself, you're able to help others. You're able to put the mask on your child if you're alive. I mean, that's a pretty drastic comparison, but still, I mean, take care of yourself. It's worth it.
Yes, so we found 2 more studies. Both were an 8-week workshop designed to train people to be more self-compassionate. Study 1 was a pilot study that found significant pre- and post gains in self-compassion, mindfulness, and various well-being outcomes. That was a weird way to say that. Study 2 was a randomized control trial that compared a treatment group with a waitlist group, found that intervention participants reported significantly larger increases in self-compassion, mindfulness, and well-being. And the gains were maintained at 6-month and 1-year follow-ups. So they did not say if they continued doing the interventions for those 6 months or 1 years, but either way, the gains were maintained that long. So whether it was because they continued or didn't, it was a very worthwhile intervention.
Yeah, that's awesome.
So what are some examples of self-care? Can't
Great
talk.
question. So some common examples of self-care include things like, well, anything that makes you feel better or function better. So like maintaining a regular sleeping routine, very important. We've been talking about sleep a lot. Eating healthy, spending time in nature, doing a hobby you enjoy, expressing gratitude, getting exercise, meditation, all of these things that we've talked about on this podcast are like ways to take care of yourself. And it can look different for everyone, but it should basically promote health and happiness for you, which is great because this podcast is called the Health and Happiness Podcast. So you're welcome. Self-care. Take care of yourself. Travis, do you have any favorite ways to take care of yourself? What do you do for self-care?
Gym, hike, meditate.
Mm-hmm.
That's pretty much.
Yeah.
That's probably 90% of my self-care.
Yeah.
Eat okay.
Yeah.
Okay. Yeah. It's not great. Not always. Lots of quesadillas.
Oh, so good. They're good for your soul.
They're so easy to make too.
So good. Cheese and tortillas. Oh, love it. My favorite ways of taking care of myself and self-care are a lot of the same. Exercise is obviously the one time a day that I really like. I don't care what plans I have. I don't care if I'm traveling. I don't care what is going on in the day. I still carve out the time to do my self-care, which is exercise. And it is my time. It's me time. But self-care for me also looks like journaling, talking to people, things that just restore my spirit, because the world can be hard sometimes. Life can feel heavy and not super fun, especially when you're working in the healthcare field. We both work in the healthcare field. We see some hard and sad things. And I think taking the time to really, again, I said this already, fill your own cup. It helps me do my job better. It helps me be more compassionate with my families and the things that they're going through, because I can't really be compassionate with people if I'm not doing that for myself. If I don't give myself compassion, how am I expected to be empathetic? I am an empath, so I feel everything very heavy, very, very hard. So I think this is just I love this topic because I think it's so important.
I don't think I am.
You're not an empath?
I don't think so. I think, part of it's because my views on death have changed since being in my career. I've just seen it I've seen it go very well and very poorly, and it's largely based on choices. We should have an episode on that sometime.
Yeah, we should.
We should make the episodes that we say we should make when we're recording this.
When we're recording, because I feel like we have an idea for an episode every episode. Yeah. But then we don't write it down and then we forget about it. Although that one's I've seen that one on our list. That one is on the list.
Anyway, so challenge this week would be to schedule time into each day to do something for yourself, to fill your own cup, as Lauryn likes to say. And I think, it doesn't have to be long to start, just something. We started the meditations with 3 minutes, I think. Just do something for yourself every day.
Yeah, fill your own cup. You can't pour from an empty cup.
Anything else to add?
I don't think so.
Well, this was fun.
This was fun.
Thanks, everybody. We'll see you next week.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.